how we can choose our TEDs. And I don't know if the listeners are beginners or are more experienced. I try to adjust my presentation accordingly. So it is interesting both for someone who's new with TEDs and who might be afraid to use them, and also for those more experienced. And I would like to begin with an article, a very nice article from Vincent Kokic a few years ago about the miniscrews, and it's entitled "It's Only a Screw." I also heard Bjorn Ludwig speak about this article, which tells us that TEDs are really screws. And first of all, we have to analyze and diagnose, because this gives us the why we do what we do. Without a proper analysis and diagnose, we can have the best screws, but we don't know what to do with them. So first, analyze and diagnose to get us the why, so that we can set the goals, which gives us the what do we have to do. And then we can settle for TEDs and for the rest of the biomechanics. So in this order, first diagnose, then set the goals accordingly to our diagnostics, and then try to figure out how we can get to these goals with the least amount of secondary effects and to be as effective as possible. Okay, so why do we use these mini screws? Because they are a very good anchorage, bone supported, and we can have the movements we want with a minimum numbers of side effects. And I will try to give you some examples later. And I really like the SWOT analysis. I don't know who of you are familiar with the SWOT analysis. They are mostly used in multinational companies, and they gives us the strength, the weaknesses, the opportunities, and the threats. And I did this a long time ago for mini implants, and this is what came out of it. So what are the strengths of the TEDs? They are reliable anchorage. We don't need patient compliance. They are easily placed and easily removed. We avoid secondary effects, and we can reduce treatment time by avoiding these secondary effects that we don't need to have to spend the time correcting afterwards. The opportunities is we may avoid surgery, extractions, extraoral appliance. We can use them very easily in segmental orthodontics in preprosthetic cases. And they are very easily placed between teeth exactly where we want them to. The weaknesses, they may break, fail, they are operative sensitive, which means the more we use them, the more experienced we get, and the easily it will be for us to use them. And we need good bone quality to place them. And the threats, there's a risk of loosening, of infection, of root resorption, and sinus penetration. And I will try to cover some of these topics in my presentation.